All right, so our next speaker has been in family practice, is a family practice physician with a passion for natural healing. He holds an undergraduate degree in nutritional science and is a fellow of the Academy of Wilderness Medicine. He's a medical director for Crater Lake National Park in Jackson County and the Oregon's Sheriff Department. Please help me give a round of applause for my good friend and colleague, Dr. Patrick Yeakey. So when Dr. Yeakey agreed to do an interview, he didn't really know what I was going to throw at him. So I'm going to try to take it easy. Should we take it easy on him, or should we throw some good ones at him? Okay.
This is unrehearsed.
This is unrehearsed. So one of the things that when I first got to know you, which I thought was awesome, was not only the powerful passion that I heard when you were talking towards natural health, being a primary care physician. That's often, you don't see that very often, being a primary care physician as natural-minded as you are. So my first question is, what was it that I don't want to say made the switch, but kind of, what made you go more natural as opposed to mainstream medicine?
Actually, my upbringing was with a much more natural bent. My parents were very much into nutrition and growing food, so that was more my upbringing, and then that was hence my degree in nutrition in college. But I made the choice to go to medical school, partly just because I wanted to know more of kind of the mainstream system to kind of know how the big machine worked, and hopefully institute changes within mainstream.
And I love the term machine, because that's how I say it a lot, because a lot of people will ask me to say, how do we make this change, or why are we just hearing about this information now? And I say it's like turning an aircraft carrier. What do they say? It takes I think a mile to turn an aircraft carrier. And I think we have such a machine that's going on, and you have so much so-called conventional wisdom that you have people learning from other people that are stuck in their ways, and it can keep perpetuating. From your perspective, working in mainstream medicine, what do you see from a patient's perspective? What would you say are the biggest things that a patient needs to be aware of as they're navigating and guiding through this system?
Definitely in this system, when you see a physician, most physicians, everyone's a little bit different, but also maybe where that physician is employed as well, but there are certain guidelines and expectations of the providers and what they have to do, what they have to accomplish, and a lot of that is diagnosis, disease driven, such as diabetes. There are definitely very certain things that have to be accounted for when that diagnosis is addressed.
So when you have someone, let's just use that for instance, let's say hypertension or cholesterol or diabetes, when someone comes in, how is it structured now in terms of some of your experience? What have you seen the downside to be as physicians being forced to follow certain protocols? What have you seen with that?
Well, especially in being more natural and hoping and why you're all here to institute more natural approaches and be more empowered to make those changes yourself, that's not something in the typical practices that we have time or are trained to do or have support. We don't have the village to do that. When you come in, a typical visit for diabetes, you're typically going to make sure yes, some good things, had your foot exam, your eye exam, but there's also certain requirements. You're supposed to be on a statin, you're supposed to be on an ACE inhibitor, irregardless of cholesterol levels or blood pressure levels. So certain guidelines. I
want to stop on that for a second and make sure everyone heard that. That irregardless, we say that again, what you said about where they're at and the medications?
Irregardless, certain medications for the diagnosis of diabetes, for instance, are expected to be part of their routine care.
So what you're saying is if someone has diabetes but their blood pressure is fine, they're supposed to be on a blood pressure med?
Mm-hmm. It's considered preventive, prophylactic for the kidneys for diabetics.
So if someone has diabetes, for instance, and let's say that their cholesterol is fine, are they required to be put on a cholesterol medication, such as a statin?
Ideal practice is that they are on a statin. Again, it's considered prophylactic or preventive medicine for future disease, cardiovascular disease.
Have you seen instances where providers have been incentivized financially to follow those prescription medication guidelines?
That's been up and down, and different organizations handle those things differently, whether it's financial or whether it's more a rating of providers and how they manage those now. I know a lot of organizations used to be, as far as like, we'll use diabetes as a great example. For care management, it would be what percentage of your patients had their eye exams, their foot exams, what percentage is on a statin, what percentage is on an ACE inhibitor. And that's part of your overall care of diabetes. And some salaries or bonuses could be based on your overall care with that.
So correct me if I'm wrong, so I think what I hear you're saying is that if a patient comes in and they say, hey doc, I really want to work towards getting my diabetes under control and naturally working with my blood pressure and my cholesterol, and they don't want to take that drug and they want to do it with lifestyle, would that physician in some areas, would that physician be docked for not getting them on those drugs?
Again, if any of their bonuses or salaries are based on that, yes. But definitely, besides whether it's a salary issue, whether it's more of their rating as far as how they manage certain illnesses, that's still out there.
And what do you mean by rating?
Rating, like there's websites you can go on. How does this doc control diabetes care? And it's kind of a group of all those categories, and it's like you're given a number compared to peers. This doc's only at 25%. You know.
So if I'm hearing you right, what you're saying is that if a doctor works really well with helping someone get off their medications, then they could actually have a lower rating?
Yes, absolutely. Yes. Nutrition, diet are not part of the rating.
So as a consumer, if you go online and you're looking up a doctor and you see this doctor has 5 stars, does that mean that they're 5 stars at getting their patients on drugs? And a 2-star means that they're really good at not following?
So you want the lowest star. Not necessarily.
So the takeaway is look for the physician with the lowest star. That's who you want to go with.
It will depend on the rating. It absolutely can be that way. If you're self-motivated and make those changes, you might want the lower star. It depends on the rating system that you're looking at. Because what I'll get at, a lot of systems are changing where, especially more of the bonus-related systems, they're changing a little bit. Instead of saying, okay, are these patients on ACE inhibitors and statins, is how many have A1Cs under. So that leaves a much broader category. That's not for rating on how good they are at controlling diabetes. That's more the bonus and pay systems are switching to that.
So in terms of the pay structure, what is the range that you've seen or that you've heard? What kind of bonus is available to physicians that prescribe medications? What have you seen be that range for bonuses?
Well, first I want to clarify when we talk about things like this, it's not prescribing a certain drug. Docs never get reimbursed for certain drugs. Patients always think we want to prescribe certain drugs because we get money. No, never. That's never the case for that. But as far as categories, like for the statins, it's most systems that I've seen that do this, it's going to be percentage, what of that goal. The goal is 100% are on statins. So if you're at 50%, you get this much of that bonus. If you're at 75%, you get this much of the bonus.
So is it safe to say that the more meds they put someone on, the higher their financial bonus in that regard?
Well, just in those categories.
Okay. What has been some of the ranges of bonuses that you've seen or that you've heard of in the medical community?
For that category specifically, I can think of upwards of $2,500.
So $2,500 if people depend on the range?
Just for that category, yes.
Just for that category?
Yeah.
So what incentive do physicians have to get people healthy and off their drugs?
With the pause.
You see, that was a good pause there, right?
Well, like I said, a lot of systems, and this is much better, it's much more holistically approached. A lot of systems with the bonuses are switching to more, are your diabetic patients having their A1C under control? So that's better. It's like kind of like moving that whole freight train, turning it a little bit, rather than being just, are they on a statin? It's, is their A1C down? Which leaves open the category of the whole diet, nutrition, lifestyle, which that alone is not a plus on the physician's chart.
And I think you said before, I overheard you say that when a patient comes in, they have check marks. They talked about the eye exam, I know we're on the topic of diabetes, for instance, but they'll have a checklist to go through. And then where does the checkbox come in for nutrition and lifestyle and those types of things? And what does that mean when they check off the box, and what kind of training are patients getting with that?
Rarely is there ever a checkbox for that. What you will see in a lot of forms, a lot of providers will see, is diabetes ed, which isn't what you'll get into more like this whole conference about a whole lifestyle of nutrition and exercise. It's just, did they get diabetes ed? Which, that's a pretty broad category.
Huge interpretation.
Yes.
Do you remember how many hours of nutritional training you had when you went through school?
My school, we had maybe 4 in medical school.
And how many hours was your overall degree? About 5,000?
Oh goodness, I don't know. A lot. A lot.
So, but I've seen a lot of medical programs be about a 5,000-hour course. So you had about 4 hours of that in nutrition. If you had to guess, what about for pharmacology and drugs?
Oh, it's continuous throughout the whole training. It's continuous.
So with patients trying to navigate that, I mean, how can they be empowered when they go to their physician? Or how do they pick a good physician? How do they know if this physician is going to help them work towards getting healthy and getting off their drugs? Or are they going to be more trying to get them on certain drugs because they're incentivized?
For sure, it's that whole, it takes a village concept that don't expect your provider is going to be the one to know what kind of nutrition you're going to need to do that. You know, it's not expecting that person to be the go-to per se to tell you exactly what to do or sit there and have time, because most provider visits are very short, 15, 20 minutes. They don't have time to talk about the nutrition. And I know a lot of physicians are very stressed by that, and they don't want to hear that question from a patient because they're not given time for that. And it really, that doesn't do it justice to expect that, because you need time, you need courses, you need hours and one-on-ones. It takes time to do that. So just don't have that expectation, but hopefully it's a discussion you can have with your provider about that's the way you want to go. You really want to do that, and I think you'll find most providers will be very supportive in that and really encourage that. They themselves may not have the resources.
So I'm sitting here thinking, okay, so if I'm a patient and I have a health issue, I'm on medications, and I'm coming into you as a provider, what questions should I be asking when I come in to know if it's going to be the right fit or you're going to actually help me get my health back?
Well, certainly if you already have some ideas of what you want to do, like have your list of goals from this conference, bring that in. And go over that with the provider and say, is this something you can support me with? Not expect, don't say like, I want you to show me and do this with me, but just support me with this. And then you've got the resources, like this is the start of your village right here. It's like you've got resources of where to go to do that. But having your provider just be supportive and say, okay, yes, they'd be happy, love to see you go through that, and they'll help manage your medicines, decrease them as you need to have them decreased.
And that's one of the things throughout my years of practice. I've had physicians that we have mutual patients, of people that have gone through one of our coaching programs and they've maybe got off their diabetic meds or their fibromyalgia or whatever their medications they're able to start reducing. And I've had some physicians that will call me up and say, oh my gosh, this is absolutely amazing what you're doing, Dr. Gala. We need to collaborate. I don't even understand how this works. This is amazing. This is phenomenal. And I've also had physicians that have called me up and have cursed at me over the phone, saying that I'm crazy and I'm going to kill other patients and yada, 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 which amazes me that we get blasted for wanting to help people get healthy. But so how do you, I guess, navigate, how do you find a physician that's on board with getting healthy and has that extra background more than just 4 hours of training? How do you find that?
Well, honestly, mostly word of mouth, going through programs like this and learning from your friends and family who've all done that. And it's all referrals, word of mouth, really. You can't tell by total strangers, like moving to a new town and looking up their office websites. You can't tell. You can't, well, unless their office specifically says, we have my diabetic solution here.
We're partnered with Dr. Gala, so come on in.
And a lot of private offices will have that kind of service, and then you can obviously tell.
What would be, if you wanted people here today to take away one thing, what would that one thing be you'd want people to take away?
Be self-empowered. Know what you want. Know that no diagnosis is a permanent thing. And most of what you're going to have a provider do is help manage that, but not actually cure it. So be self-empowered to know that you can make the changes. You personally have to make the changes to fix that.
Great. And how many stars do you have? You don't have to answer
look at those
that.
sites.
But I remember you saying that in terms of the stars, because an uneducated person could just, well, I don't mean uneducated, but not familiar with the system, I guess would be a better phrase. People not familiar with the system of rating could go to their insurance company or could go online and say, this physician, and they could look at you and say, well, maybe Dr. Yeakey has low stars because you're getting people off medications, because you subscribe to diet and exercise usually are enough. You know, how would they know you if they're looking at mainstream numbers? Just like you said, word of mouth, or?
Really, you really can't go by reports that companies put out, insurance companies, and the like AMA websites, because they have certain guidelines and protocols they're following for those reports, and they're just numbers, and we're talking about millions of providers and different parameters, and those charts aren't a good way to go.
Awesome, great. All right, well, Dr. Yeakey, thank you so much. I appreciate it.